Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel.
Hi everyone, welcome to today's webinar, Helping the Sound Sensitive Dog, sponsored by Your Dog's Friend. Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. Since 2006, we've been promoting the use of positive dog training methods by hosting free webinars just like this one, posting valuable resources on our website, and offering affordable dog training classes in person and online, and providing free advice and referrals. Our speaker today is Dr. Sameera Nalla. Dr. Nalla is a veterinary behavior resident working with Dr. Pike and Dr. Learn at the Animal Behavior Wellness Center in Virginia. After completing 4 years of general veterinary practice in Minnesota, she was inspired to continue her pursuit of animal behavior education and is working towards becoming a board-certified veterinary behaviorist. Dr. Nalla is fear-free, low-stress handling, and human-animal bond certified. Before we begin, I'd like to remind you that Your Dog's Friend is a nonprofit, so if you find this webinar helpful, please consider making a donation to help support these free webinars and the other free resources that we offer. If you'd like to donate, you can visit our website at yourdogsfriend.org and click on the donate button in the upper right-hand corner. So over to you, Dr. Nalla.
Well, thank you so much, Carrie, for your introduction and everything you do with Your Dog's Friend. As you can see, today's presentation is about helping the sound-sensitive dog. I think it's always nice to meet your presenters. Just to introduce myself, I was born and raised in a small town in Minnesota called Worthington, Minnesota. I went to undergrad at Carleton College, which is in Northfield, Minnesota, where I majored in history and I minored in neuroscience. And then I went to veterinary school at the University of Minnesota. After graduation, I went straight into small animal general practice, and I did that for 4 years. And then I was lucky enough to begin my residency with Animal Behavior Wellness Center. And so these are my critters. My dog Otter. I have 2 kitties. I have Miko and Loki as well. And to start the topic of talking about noise phobias today, I just wanted to go over some background information just that I think is important to understand as we kind of delve further and further into this, starting with just some definitions. So when we're talking about anxiety, we're talking about the anticipation of something dangerous or that we perceive as being threatening. We might not be able to identify what the source of that is, as it might not be present, but we're anticipating that fear. And anxious behaviors can be exhibited in the absence of the eliciting stimulus. So again, it's about that anticipation, whether even if the threat or perceived threat is not there. The next topic of fear, or definition, I should say, fear is when your body responds to a threat that you can actually see or hear, and it involves psychological and behavioral and emotional elements. It's associated with something specific, and it can lead to anxiety in the future. The last definition is what we call phobias. And phobias are persistent as well as maladaptive, out of context, out of proportion fear responses to the stimulus that is present. So it's basically an intense physiological response to what we're fearful of. So with talking about noise phobias specifically, we can talk about it in different ways. Many dogs experience stress when faced with a noise, and they're not necessarily that intense sort of noise phobic right away. Sometimes people talk about this differently, where they talk about being noise reactive or noise sensitive or having noise averse dogs. And I just wanted to make it clear that I'm talking about everything in kind of the umbrella term today of being noise phobic or noise phobias. But noise phobias themselves are profound, persistent, excessive fear of noises that is abnormal in relation to the environmental context. And responses can range from being completely catatonic, like I'm totally shut down, I'm totally, I don't want to be there, I'm scared, I'm not doing anything, versus manic state where it's just like complete panic, pacing, panting, running all over the place, that sort of thing. Noise phobias, they can persist beyond the duration of the actual noise. Sometimes it can take, minutes, hours, even days for dogs after a noise event to kind of get back down to where their baseline is. It can become associated with other triggers, unfortunately, too. Sometimes we might think about noise phobias with, for example, separation related behavior or separation anxiety, where say a dog is by itself at home and then a thunderstorm happens at that time. Now, every time it's alone, it becomes anxious about that happening again because that is the environmental context in which that storm happened. So it can become associated with other triggers, and animals may show a sense of anxiety or fear before the noise even occurs because of different environmental cues that might become predictable for that noise happening. So next slide. What happens to our bodies when we have that sort of response? Dogs, just like us, have activation of their sympathetic nervous system, which leads to physiological changes in the body, which is associated with the release of epinephrine. And that's kind of what leads to that fight or flight response that we can get when we face something that we're worried about. And so with behavior responses in dogs, we can see them become hypervigilant. They're always scanning around for threats, looking at, where the next thing might be coming from. They become avoidant. We can see aggression. With the cardiovascular system, you can see an increase in heart rate. Respiratory system, same. You can see an increase in breathing, metabolic changes, the HPA axis, and that kind of is what regulates our stress response, changes. We can see glucocorticoids being released, which again occurs with stress. As far as our gastrointestinal system, we can see a decrease in appetite, vomiting, diarrhea, hypersalivation, drooling. MSK stands for musculoskeletal, where we can see weight loss with chronic stress, increased motor activity, where, we're panting and things like that, pacing. And we can see self-injurious behaviors too, where say if a dog is in a crate and trying to escape during that noise event, it might hurt its, break its teeth, bloody its gums. Sometimes dogs lick themselves when they're anxious, so they might get, an injury from chronic licking of the same spot, things like that. That goes along with skin, excessive shedding and secondary lesions from that self-injurious behavior. And then ophthalmic with our eyes, it's pretty common. Probably doesn't come as a surprise to anybody that we can see those big dilated pupils as well. So those are just some of the changes that can happen when our system, our bodies face something stressful and scary. So why does it happen when we're talking about noise phobias in dogs? There can be a lot of different contributing factors, but it seems to be that sudden, loud, unexpected, and unpredictable noises are a common trigger for fearful behavior in dogs. Previous traumatic experience with loud noises is a reported risk factor for the development of noise phobias. And if this intense sort of fear response cannot be controlled, like say, you have your smoke detector low battery going off while you're away and your dog's at home and can't escape that sound, when the dogs can't control their environment in that way, that can also be something that leads to a noise phobia. And if you've seen Anchorman, that's the meme I put in there about loud noises, where, nobody seems to really enjoy loud noises. And we want to try to control that as much as possible. So moving on into other reasons noise phobias can happen, they do very likely seem to have a genetic component. If relatives of a dog are known to have noise phobias, chances are that others in that lineage will too. And breeding dogs who do have noise phobias should be considered likely to pass on that condition to their offspring. So something of being mindful of when we're breeding dogs. There can be changes to hearing that happen in life. It can improve early on, and then, as we get older, it can diminish. So being mindful of those age-related changes as they happen. There can be a lack of early experience in life. In thinking about developmental periods for dogs, the first kind of fear period or socialization period is very young in life. It's about 8 to 12, maybe 14 weeks of age for dogs. And if, they don't experience noises that they might encounter during that time, experiencing it later in life can just make it that more novel and fearful to them. And, it just makes it all the more scary because it's not something that they got accustomed to early in life. So there's learning history over time that changes and continues to change because we know behavior is dynamic and it's always changing. But if there are traumatic events that happen with those loud, unpredictable noises and they continue to happen, that can certainly contribute to becoming or developing noise phobias down the road. There can also be some degree of social transmission, and say you have a dog who's barking at, something out the window, and then your other dog isn't even looking at it, but then comes running over and starts barking. So there can be that degree of, if you have a noise phobic dog, is their behavior going to be something they share with their housemates because they're just like, this is what we're doing because this is happening, and that's what they learn. And there can also be, we suspect there to be some abnormalities happening in the brain too. Neurotransmitter abnormalities, an overactive locus ceruleus. The locus ceruleus is a structure in the brainstem which regulates that arousal level and produces a neurotransmitter called norepinephrine, which we'll talk about more later. We could have a malfunctioning amygdala, and that part of the brain is our emotional processing center and controls our fear response. And then there can also be atrophy of the hippocampus, which the hippocampus is a structure in our brain that's heavily involved in learning and memory. So, all these areas are pretty targeted areas for kind of that fear response and how we learn and how we act over time too. As we continue to practice those behaviors, those pathways continue to make connections and just keep getting stronger. And so the other thing that, as a veterinarian is a really big thing that I'm always looking out for when I'm seeing patients is if there is an association with pain. And so there was a study done, a qualitative study. I forgot to put the name in it here, so I'll add that so you guys can see it later. It's in my resources too, but the aim of this study was to explore signs of noise sensitivity in dogs with pain and without pain. There were 20 dogs who presented to see a clinical animal behaviorist, and all these dogs had a similar age of onset of a noise sensitivity. 10 dogs presented with pain, and those were considered the clinical cases. 10 dogs presented without pain, and those were considered the control cases. And those sudden loud noises were a common trigger between both of those groups. The age of onset of noise sensitivity in the clinical cases actually averaged about 4 years earlier than those in the control cases. And so again, these clinical cases were clinical for pain as well. And then all of the clinical cases received nonsteroidal anti-inflammatories to help with pain and inflammation management. And 9 out of 10 dogs in that group, their noise sensitivity actually improved when pain was managed too. So I'm always looking out for pain for any of our patients, especially if it's kind of a sudden change that has happened. Moving on. So just talking about sounds and how we think about them, I think having some more definitions can be really helpful. So sounds and what they are. Sounds are audible variations in air pressure. And frequency is the number of cycles per second, and we measure that in hertz. So for humans, our hearing range, as far as normal hearing goes, is between about 20 to 20,000 hertz. For dogs, their hearing is, for normal average dog hearing, their hearing is 15 to 50,000 hertz. And dogs are most sensitive to frequencies of around 500 to 16,000 hertz. So as you can appreciate from seeing those numbers, dogs can hear sounds both lower frequencies as well as a lot higher in frequencies than what we can hear. And so noises dogs might be reacting to might just be things that we can't even perceive. So I think that's something that's something really important to be aware of. The other measure of sound that we have is how loud the sound is, and that's measured in decibels. Greater than 70 decibels is loud for humans. Greater than 95 decibels, it has been shown to lead to stress behaviors in dogs, like lip licking and panting and things like that. And then greater than or equal to 125 decibels is what the human pain threshold for hearing is. And it is likely similar to that of dogs too. So to get a sense of what sounds like what, looking at these decibels, if you look at just sort of like decibel scales, you can find a bunch of images on Google. You can see the threshold of hearing, how soft normal breathing is at less than 20 decibels. And then as we look up and up, whispers are still really soft at around 30, but screaming baby gets up there to around 80. And if we go back, loud for humans is 75. And then gunshots are just incredibly loud, and that's where that pain threshold lives too. So we can understand that these are really intense experiences that both people and dogs experience with those really loud sounds like thunder, gunshots, fireworks, and other environmental noises too. So I just put some examples of environmental noises that dogs could potentially develop phobic responses to. This is by no means a comprehensive list. I'm sure you guys can probably think of others too, but again, the smoke alarm detector beeping, the microwave either humming as you're warming some food up or beeping when the food's done, ambulance sirens, tornado sirens, vacuums, the washer or dryer and doing laundry. If you accidentally drop something on the floor, again, the crying babies on there, because we see a lot of people who have young children. AC units can be really loud. Living in a busy, urban environment with traffic and honking and all that. Power tools, the dishwasher, the refrigerator, even the, sound of ice cubes dropping from the ice maker can be really loud and jarring. And then noises from the TV, phone, things like that. So again, I'm sure there are other things like airplanes, helicopters going over you, things like that can contribute as well. And so on this slide, I just wanted to mention that there does seem to be some breeds that seem more sensitive to being noise sensitive or having noise phobias. That's a picture of my sister's dog. She's a German Shepherd named Mazikeen. We call her Maze. She definitely has some noise sensitivities too, but we love her. She's turning 1 next week. But Shepherds are on this list, collies, herding dogs, gun dogs, but it doesn't mean that it's going to happen to all of those dogs, and it can really happen with any breed of dog. I just had an example where I never got to meet her, but my brother-in-law growing up had an English setter who was a gun dog, and she didn't care about gun noises, didn't care anything about them, but every single other noise she was terrified of. And so again, I think that comes from that socialization period where they made sure that she was really accustomed to hearing the noise of guns going off, but she never really had experience with other noises too. All right, and so when we're talking about fear responses in dogs and what type of behaviors we might see, These are some of the behaviors where, again, this isn't an all-inclusive list, but I think these are some of the big ones that people see often: barking at noises, yawning, lip licking, vocalizing, hypervigilance, where, again, scanning for the threat constantly, not resting well, retreating, panting, hiding, shaking and trembling, pacing and that locomotor behavior where they're constantly moving, clinging to the owners, seeking comfort, whining, decreased appetite, and destructive behaviors can be seen too. The ones that I have bolded are the four most common ones that were reported in a study: barking being the most common, then retreating, then hiding, then pacing. And that's going to be in this next slide where I'm going to talk about that study. All right, so in that study that was looking at environmental noises and surveying dog owners on the different things their dogs reacted to and what those reactions looked like behaviorally, Griggs et al. Found that dogs reacted more intensely to high frequency and intermittent noises. Again, the low battery on the smoke detector versus low frequency and continuous sounds, such as the vacuum cleaner. And in this study, they looked at 94 human reactions in video clips that were provided. About 21% of people reacted to their dog's reaction with amusement, and about 20% deliberately antagonized their dog to elicit that sort of reaction from them. And so I think it is really common for us to see clients come in with their dogs when their behaviors are directly affecting them. Like, say their dog bit someone, they're worried about their kid's safety. They, can't go on walks because the dog is lunging and barking at dogs and things like that. That is stuff that directly affects us as people. And I think something we don't always think about is that dogs can still be shut down and be really scared and fearful too. And even if it doesn't directly affect us, it's directly affecting them and their quality of life, their welfare. And we just want to make sure that they live comfortable, happy lives. And recognizing that fear sort of shut down response is just as important as recognizing things like fear-based aggression too. So recognizing that noise phobias are truly a welfare concern and something that you definitely want to address with your veterinarian, with your veterinary behaviorist, because we want to address that and make your dogs feel comfortable and feel more comfortable when they face those stressful situations too. And so next slide, this is the last section of my presentation where we kind of get more into what behavior therapy plans look like and what you guys can do as pet owners, as dog lovers, as veterinarians, animal professionals. What are things we can do to help out our dog friends? And so when we are coming up with a behavior therapy plan for our patients, there are 3 different pillars or tiers or categories that we are coming at our behavior therapy plans with. We use all 3 categories in conjunction with each other because typically it's not just going to be one area for our patients that is going to be successful on its own. It's usually using all 3 strategies in combination where we achieve the most success. So those 3 pillars are environmental management strategies. Then we also have medications, supplements, adjunctive products that are used to help bring down that anxiety level so it's a lot easier to go back down to our baseline. And then we also have what we call behavior modification training, which is how we help learn dogs to be comfortable in the world that we live in and teach them those alternative, more desired, relaxing sort of skills so that they can build better coping ability and build resilience too. And that's also where awesome training companies like Your Dog's Friend comes in. We always work in combination with our trainers and with our clients to, again, achieve as good of success as we possibly can. All right, so environmental management, that first pillar that I'm talking about is thinking about how we can change our pet's environment, immediate environment, to reduce his or her ability to practice unwanted behaviors. So we don't have control of everything. We can't control the weather and storms coming by, or those 4th of July fireworks our neighbors are, doing down the road, or things like that. But what we do have control over are in our own environment. What can we do to manage that? Sometimes that simply is doing our best to simply avoid the trigger. So for example, if there's a light component with things like storms and fireworks, keeping the windows or blinds closed can be really helpful. I haven't actually seen a client do this yet, but I've heard of acoustic tiles to help diminish noises that dogs can be sensitive to. That could come into play with creating a safe space for our dogs, whether it be a basement or an office, a bathroom, closet, their crate, somewhere away from windows, so noises aren't as perceptible. If using their crate, make sure they don't have confinement anxiety, because we don't want it to add extra layers of stress to what they're already experiencing. We want to make sure it's a safe, comfortable place. Make it comfortable and cozy, add blankets, make sure they have a nice resting place. If it's something that they enjoy, adding enrichment to that safe place, whether it be like a Kong with their wet dog food or something frozen or something like that, so it lasts longer. Lick mats, chews, other toys that they might really like, and to make sure that this space is a dedicated space for the dog, that no one else can go in there or bother them. And we want to make sure that it's their safe haven during these events and that they know they can go there to feel more comfortable too. And that's just a picture of my dog wrapped up in a blanket, being all comfortable and cozy. All right. Other environmental management strategies, you may or may not have heard of the phrase acoustic or sound masking. But what that concept is we are adding sound to reduce the intensity of whatever the fear-inducing sound is. And by doing so, that makes it more difficult to hear whatever the unwanted noise is, and makes it more difficult to discriminate between whatever the fear-inducing noise is and those other ambient environmental noises that are happening. So, things that we can think about adding to the environment near that safe place for the dog is white noise machines, brown noise, pink noise, things like that. There is actually dog-specific music that you can find on Spotify as well, called Through a Dog's Ears, where they make classical music that's specific to dogs, as well as reggae music, which I think is new and kind of fun. I just thought that picture was funny of the dog on the beach relaxing to its music. But you can certainly use other music as well. I usually go with classical music. Box fans, audiobooks. There's a lot of celebrities with their, soothing voices that help put you to sleep, that your dog can listen to too. Sometimes people leave the radio on, laundry or, dishwasher, have that running, as long as that is not something that your dog is concerned about. Also the vacuum. So again, I don't want it to be something your dog is already scared about, that we're adding noises to that. We want to make sure it's something that doesn't add extra stress, so that it helps to drown out the other scary noises that are happening at the time. Continuing with environmental management, I think these are kind of fun too. There are lots of options actually for sound reducing ear protection for dogs. The dog with the orange vest is sporting a product called Mutt Muffs. There are also these happy hoodies, which are kind of sleeves that go over the dog's head that can cover its ears. We sometimes recommend sticking little cotton balls in there and then putting the hoodie over that to help diminish noises. You can see with the corgi on the bottom, the crit ear, which I don't have any personal experience with, but I have seen recommended before. And then this is also, I think, somewhat newer, phonics, where you can see the dog wearing that gray kind of helmet almost, covering its ears to help drown out any of those noises that that dog is scared of too. So there's some different options, but it's really important to make note of the fact that we need to train our dogs to wear these devices comfortably. We can't just slap them on their face and assume that they're going to be comfortable wearing it and that it's going to work to help reduce, that auditory stimuli that they're reacting to. And so it is a process. We always highly recommend working with our recommended trainers either at our practice or through our referral network like Your Dog's Friend, because we want it to be something that doesn't add a layer of stress. We want it to be something that they're completely comfortable wearing, that they run up to you, they're excited about it because of all the training that and reinforcement history behind it previously. And we want it to just be like a piece of equipment they're used to wearing, like their collar or their harness or something like that. So just some fun additional strategies to think about that might kind of be outside of the box. And environmental management with compression. I think a lot of people are familiar with the thunder shirt, which you can see the dog in the corner wearing. I've seen weighted blankets specific to dogs where that golden looks pretty happy in his gravity blanket. Sometimes people use shirts and onesies as well. They may not help. So just figuring out what works for your dog. Sometimes people think that when their dog is panicking or freaking out, that, if they tough it out, they're going to be okay and they'll learn to be okay. And that is usually not what happens, unfortunately. So don't hesitate if it helps your dog to provide them with comfort and love, talk to them in soothing voices and things like that. Where again, if they feel more comfortable with your presence and you come providing them with that comfort, you do that during their noise phobic events. We want to make sure that they're as comfortable as possible. We can also just try to be as proactive as we possibly can. Use things like weather and radar apps. If there's like a 20% or so chance that a storm is going to happen, I'd rather the dog be calm and relaxed versus panicking. So trying to plan in advance for those events. We always say one of our mantras is to be proactive versus reactive so that we're not continuing to progress that learning history of the dog. Go out of town if there's something predictable happening or take your dog out of that area where the noise is happening. We have some people with, noise phobias to fireworks specifically are just like, we're going out of town. We're not dealing with this. And we're going out of town somewhere secluded and remote, so we don't even have to worry about it. And going into that next pillar of medications, it's a good idea to kind of get some practice under your belt and know how your dog's going to tolerate any potential psych medications that help to reduce his or her anxiety before they're actually needed. So that is my way to segue into medications, which as a veterinary behavior resident is a really big part of what we do and how we facilitate the behavior therapy plan in general too. So sometimes people wonder why medications. These events are few and far between, even though the reaction's really intense when it does happen. And there's a few reasons I still think about medications for dogs who have environmental noise phobias. One is that I, at least as a veterinary behaviorist, compared to the, general practice veterinary population, see dogs with really, really intense reactions, whether they're fear-based, stress, anxiety-based. So I don't think I have ever, as a veterinary behavior resident, only seen a dog for a noise phobia. There are usually other comorbid diagnoses that these dogs are presenting for. And so there is a 2001 study by Dr. Karen Overall where she had found that dogs with noise phobias were more likely to have other anxiety-based disorders too, such as generalized anxiety disorder or separation-related behavior. So we are often concurrently seeing noise phobias with other kind of more generalized disorders as well. If there is a late or sudden onset of a noise phobia, I always want to look for an underlying medical component because it's typically behavior changes that is the first thing that pet owners are noticing in their pets and how that changes compared to their norm. And that's what brings them to the vet to say, you know what, this is concerning to me and I want to get this checked out. And so we, for all of our patients, recommend a kind of minimum database, even if there's nothing else that the client is worried about health-wise. It's always good to get things like blood work and a urine sample done. That lets me look at all their blood cell values, values like their blood sugar, liver enzymes, kidney markers, electrolytes, proteins, things like that to make sure that all looks normal. Make sure that they can appropriately concentrate their urine. There aren't any strange crystals or bacteria or anything like that present in their urine sample. And not only does that help to rule out potential underlying medical components that a patient might be presenting to us for, but it also helps give us the information that our patients can properly metabolize and excrete any of the products we might recommend too. So always a good thing to get it checked out, especially if it's a sudden change. And then again, going back to that earlier slide where I talked about pain and its relationship with noise phobias, I'm always looking for if there's potential underlying pain that could be going on too. And again, with noise phobias or with any anxious-based condition that we might see our patients for, they do unfortunately worsen over time without intervention. Another one of our mantras at work is that our patients grow into their anxiety. They don't grow out of their anxiety. So it is very common to maybe see early signs early in life and then see that noise phobia just get worse and worse and worse over time. And I think the only thing I can think of where it might improve is if an older dog's hearing is diminishing and they're just no longer perceiving the sounds that they once reacted to. But other than that, they do get worse over time. All right. And so in talking about medications, which I feel like people are always really interested in, we have a couple of different categories of medications. We have shorter acting medications, as well as long acting psych medications. Luckily for both of those categories, psych medications, they're very, very safe for our patients. We don't see longevity concerns or anything like that with them. We don't see liver, kidney damage or anything like that. And as long as patients aren't experiencing negative side effects, there's something that can definitely be continued to be used lifelong. And so those two different categories with our shorter acting medications, there's a wide variety of different short acting medications, but they vary in onset in terms of how long it takes before we see what effect they have on the patient. And they have variable durations of actions depending on the medications. Some work as quick as 30 minutes after administration. Some take a little bit longer. It might be more like an hour and a half or 2 hours. And some of them last about 6 hours. Some of them might last as long as 12 hours. So there's some variability there. Short-acting medications are useful for predictable events. So again, if there's a 20% chance that that storm is happening and we want to get ahead of it, we give it a couple hours before that storm is headed our way. If it's 4th of July week and we know the neighbors have fireworks going off at any time of day, the whole week of the 4th of July, we can use our short-acting medication around the clock for that week. And these short-acting medications can be used with long-acting psych medications too, again, as long as they are well tolerated. For our long-acting psych medications, they're still really helpful for noise phobias because, again, a lot of times these patients who do have noise phobias also have kind of more generalized anxiety disorders too. So GAD just stands for generalized anxiety disorder. And longer acting medications that, take some time to take effect, but eventually reach just a steady state where they're always working in the background. they can be really helpful for those unpredictable noise events, especially if they happen really frequently and really intensely. Like, say again, you live in an apartment complex in Washington, D.C., where there's just always environmental noises happening. We want to be able to have something that reaches that steady state that's always working to help out those patients with noise phobias, as well as their likely underlies generalized anxiety too. So drugs are our friends. I obviously prescribe them quite a lot. And it's interesting to see how they react in patients. Patients are really individual in how they respond. So we can always fine tune our plan as we continue to gather data on how our patients are responding to the different medications we might prescribe to them. So I'm going to talk about some specific medications that are out there next. But one of the medications that you may have heard of specific to noise aversion or phobias is Sileo. Sileo is an oral mucosal gel, and it's in a class of medications that we call alpha-2 agonists. So you can see in that picture there, it comes in a syringe with a little cap there, and that green stuff is the gel that is the medication. It is FDA approved for canine noise aversion. It can cause sedation and have anxiety decreasing effects. It has been proven to be effective in reducing acute fear response and by causing minimal sedation too. Dogs aren't zombies on this medication. They're not completely, knocked out or anything like that. It can be administered about 30 minutes prior to any noise event that we can predict, but it can also be given at the first sign of distress. So if it's that storm that came around that wasn't even in the forecast, you can still administer this medication, and it can be redosed every 2 hours for a total of 5 times. In one study on Sileo from 2020, 72% of pet owners observed a good to excellent response to their dog who had noise phobias being on this medication versus 37% in the placebo group. And this is, I know in my previous slide, I had said to test medications and products before they're needed. But because Sileo actually has a short shelf life once it is opened, and because it seems to be well tolerated, we typically tell clients when you try this medication, the first time is going to be when you're kind of in a pinch. You have a noise event that's happening that you weren't expecting, like the smoke alarm beeping, and you just need to give your dog something to help him or her out. You can still administer this, and it's going to be that first time you administer it. You're not going to necessarily test it before you actually need it. So this is kind of the exception to the rule, but I thought I would play for you guys. It's a short, about 3-minute video about Sileo, because I think one of the issues sometimes clients face is making sure that they administer it appropriately. So this video just kind of shows you what it looks like and how to do that.
This is Bella. She has been prescribed Sileo by her veterinarian. Sileo is a medication used to alleviate acute anxiety and fear associated with noise in dogs. It's good to anticipate anxiety triggering situations and administer the medication in good time. You can easily administer Sileo to your dog at home. Start by putting on a pair of disposable gloves. Here's what you need to do to administer Sileo correctly. The Sileo oral syringe contains medication for multiple doses. When you use the syringe for the first time, set the dose by turning the dosing ring towards the tip of the syringe. For example, if the dose prescribed by a veterinarian is 3 dots, turn the dosing ring until you see 3 dots between the dosing ring and the syringe barrel. Check that the edge of the dosing ring is exactly at the black graduation mark. When you are confident that the dose is correct, remove the cap from the syringe. It's supposed to be tight. Don't lose the cap so you can close the syringe after use. Take a firm hold of the syringe. You can hold the dog's snout in place with your other hand. Gently place the syringe between the dog's cheek and gum. Sileo is absorbed oral mucosally. Do not open the dog's mouth. Unlike other medication, Sileo should not be swallowed as it does not work if swallowed. Press the plunger until the dosing ring causes the plunger to stop. When using Sileo, your dog should be able to interact normally. Place the cap back onto the syringe. The product is sensitive to light, therefore it should be stored in its original package. If the fear-eliciting event continues and the dog shows signs of anxiety and fear again, redosing can be done when 2 hours have passed from the previous dose. The product can be dosed up to 5 times during each noise event. You can find more detailed instructions on the leaflet inside the package. Please read them carefully.
Hopefully that gave you a lot of information about what Sileo even looks like, so you have an idea of how that would be administered. For a lot of my patients who might have, either maybe like dental pain or who have conflict aggression and don't like when people come near their face and things like that, you just have to be mindful of making sure you can comfortably and safely administer Sileo. The other thing I like to talk about with Sileo is that because it is absorbed on the mucosa, the oromucosal surface, it is actually vasoconstricting. So we can actually see where you administer the medication, it blanches the gums. It's not universal throughout the oral cavity, it's just where it's administered, but I don't want anybody to get worried and be like, oh my gosh, my dog's gums are so pale, he or she is anemic or anything like that. That is a normal thing that we see with Sileo. So don't be alarmed if your dog is on Sileo and that happens. It's because of that local vasoconstriction. But moving on to other short-acting medications that we often use, clonidine is an oral medication, so it is a tablet that is also an alpha-2 agonist like Sileo. The way alpha-2 agonists work is they block norepinephrine release in that area in the brain, that brainstem region that regulates arousal and produces norepinephrine, called the locus coeruleus. And norepinephrine is one of those neurotransmitters that is released as a response to acute stress. So in this 2011 study by Ogata, there are 2 different groups. Group A had a diagnosis or a combination of diagnoses such as separation anxiety, noise phobias, storm phobias, or a combination of some of the above. 7 out of 10 or 70% of the owners reported in this group that clonidine was more effective than other medications that were tried in the past. Group B had fear-based aggression of some sort or the other. 92% in this group reported improvement in reducing the intensity of aggression with dogs who were on clonidine for this different sort of set or category of behavior problems. So it does have a really good and favorable response to a lot of patients. Takes about 90 minutes to take effect, and it lasts about 6 to 8 hours. And it can be given, again, around the clock if needed. Another short-acting medication, I feel like veterinarians are very familiar with trazodone, and everybody gets trazodone. Dr. Margaret Gruen is a diplomat, a board-certified veterinary behaviorist, and she did a study in 2008 on trazodone. Trazodone is a serotonin antagonist and reuptake inhibitor, or SARI. This was a retrospective study that was done on 56 dogs with anxiety disorders. And again, combination or different diagnoses, generalized anxiety, separation anxiety, storm, noise phobias, or a combination of some of the above. And trazodone was added as an adjunctive to long-acting medications like SSRIs or TCAs. It was well tolerated over a pretty wide dosing range, and it did enhance the calming effect that the daily or long-acting medication that those patients were on were taking. And trazodone also takes about, on average, 90 minutes to take effect, and it lasts for about 8 to 12 hours. Moving on, gabapentin is another short-acting medication that I feel like a lot of people have either heard of because people take it too, or have experience with prescribing or their pets taking for pain or for anxiety or for both. But gabapentin, it acts on a neurotransmitter called GABA. It's kind of the brakes of our system, of the central nervous system. It helps to inhibit nerve cells from communicating and sending messages to each other. So it's kind of like that stop sign, helps to facilitate calm and relaxed behaviors. In a 2021 study, it did demonstrate that gabapentin helped to reduce fear responses in dogs. It's well tolerated. Monitor for common side effects like sedation or ataxia, where it's kind of like that uncoordinated, drunk-like sort of gait that dogs might have. I should say too that sedation for the short-acting medications in general that I'm talking about is, if anything, one of the most common side effects that might be seen, but it also might not be seen. Gabapentin takes about 90 minutes to take effect, and it also lasts about 8 to 12 hours on average. But another class of short-acting medications are benzodiazepines, which again, I think people are pretty familiar with because they've heard of these names before. Lorazepam is called Ativan, Xanax, clonazepam or Klonopin. I often get people who are confused because clonidine and Klonopin sound similar, but they are very different medications. Benzodiazepines also act on that neurotransmitter GABA, the brakes, to help provide sedation, reduce anxiety. They can also help with muscle relaxation too. They may increase appetite. And so, I have had patients who, I had one client who emailed me that her dog had the munchies on a benzodiazepine that we were trialing, which we talked about it being a possible side effect. Monitor for paradoxical excitation. Any psych medication has the potential for what we call paradoxical reactions, where the opposite of the desired effect is what is seen. But we never know until we try. Benzodiazepines can be potentially a little more unpredictable, but not always. They can be really useful for dogs who panic and things like that. So we just have to test them out to know what effect they have on our patients. They can develop a tolerance if given frequently, where more of the drug is needed to achieve the same effect that it had previously. So that's always something to watch out for with benzos. And because there's a number of different benzodiazepines, it varies, but on average, it probably takes somewhere from about 30 to 60 minutes for the medication to take effect, and they can last anywhere between about 6 hours to even about 12 hours. So that's just some of the short-acting medications that we commonly prescribe, but they are usually not alone. They are usually in combination with a long-acting medication too. The most common class of medication that I know we likely prescribe is in the class called selective serotonin reuptake inhibitors, or SSRIs for short. SSRIs inhibit what is called presynaptic reuptake of a neurotransmitter called serotonin. And serotonin is really helpful to, again, reduce anxiety. It can help reduce impulsivity. It can help improve just overall emotional state rather than having like a pessimistic sort of cognitive bias. You have a positive one. And it can also help improve cognition too. So we know there's a learning piece of things to behavior modification too that we want to help facilitate with our behavior therapy plans too. One of the most common SSRIs that we prescribe is Reconcile, and one of the reasons is because it is dog specific versus generic fluoxetine or Prozac. It is specific to a dog's metabolism, so it is more bioavailable to them since it fits their metabolism versus a human's metabolism. They differ, right? So it is FDA approved for the treatment of separation anxiety in dogs, but that doesn't exclude it from being useful for any anxious-based disorder. There are other SSRIs that we commonly prescribe too, just because patients are individuals. One med that works great for a number of patients might not work for another. And so paroxetine or Paxil and sertraline or Zoloft are common SSRIs that we use too. SSRIs, they take about 4 to 6 weeks before we see what that behavioral effect in a patient is going to be. They tend to have a lower side effect profile than some other long-acting anxiety meds that we use. Most common side effects are typically GI related, so vomiting, diarrhea, decreased appetite, sedation may happen as well. And if side effects happen, they're usually mild and self-limiting in that they typically do resolve on their own. But if they don't, or if the side effects are really severe, we go back to the drawing board because we don't want to tolerate any of those negative side effects for our patients. I don't use tricyclic antidepressants often just because they do tend to have more side effects. Things like dry mouth, constipation, urinary retention, sometimes more significant sedation because they can have antihistamine effects. Just like if you think about Benadryl, it can make you drowsy. But again, every patient's different, so some patients do really well on them. I bring up Clomicalm because, again, this is a dog-specific medication that is FDA approved for the treatment in separation anxiety in dogs, but again, could potentially be useful for other anxiety-based disorders too, especially when they're chronically experienced by the dog. So there are also supplements. We definitely come across people who are either just not comfortable with the idea of medication or are just more interested in supplements for whatever reason. And so we always use supplements that we have scientific data and information about that actually let us know that they can be helpful for different situations. That encourages us to recommend them and use them in our patients. So one of my lovely mentors, Dr. Pike, did a study on a supplement called Excitane that was published in 2015. It is a L-theanine chewable tablet, and that is an amino acid that is found in green tea leaves. It's highly palatable. It increases GABA, that breaks we were talking about of the central nervous system. And it also has a little bit of effect on the neurotransmitters dopamine and serotonin too. In her study, Dr. Pike saw 18 storm-sensitive dogs, and the dogs with Excitane did have a significant decrease in their global anxiety scores, as well as in their time to return to baseline after a storm. And she saw, you can see the percentages, but a decrease in drooling, panting, pacing, and hiding behaviors, and a pretty good, amount, 79%, 83%, is pretty good improvement for these patients. And 94% of owners were satisfied with how their dogs responded to Excitane too. So that is always an option or adjunctive to our medication plan if we just need to make a small little adjustment and get a little more benefit. There's another supplement that we recommend called Zilkene. And Zilkene is a bovine-sourced hydrolyzed milk protein called alpha-casozepine. Also acts on GABA, just like benzos do, and has an affinity for the benzo receptors. In this 2007 study, there was a scale called the Emotional Disorders Evaluation in Dogs, or EDED scale, that was used. And they compared 19 dogs who were on a long-acting psych medication called selegiline, which is an antidepressant, and 19 dogs who are on this milk protein supplement, Zilkene, and found that the treatment in both groups, their emotional disorder score scales were decreased in both groups. There were no adverse effects reported with Zilkene. And you can see in the chart from this paper that I included that the response, owner's assessment of how their dog improved over time was pretty similar for the medication and for the supplement too. And so Zilkene is something I have in my arsenal that I will utilize if, again, people are more interested in trying supplements first before medications, or just are worried about or have, concerns about medications that they'd rather go the natural product route. We do have some tricks up our sleeve. Another supplement, probiotics. We know that there is that gut-brain axis and a connection between our emotional well-being and our GI health. There are multiple different probiotics out there, but these are typically ones I reach for more with my specific set of patients, being a veterinary behavior resident. Purina makes one called Calming Care, and the specific strain of probiotic in Calming Care is called Bifidobacterium longum. It does help with anxious behaviors, things like excessive vocalization, pacing, spinning. It also has been shown to help some dogs cope with stressors such as novel sounds, if you see that written there. But it does have to be given daily to be able to appreciate, like a long-acting medication where I said it takes about 4 to 6 weeks to see what response it has. It is going to take usually about 6 weeks to see what effect it has. Visbiome is another, veterinary probiotic that is out there that has that anxiety, that calming probiotic strain, Bifidobacterium longum, but it also has multiple other probiotic strains in it too. So I like to think of probiotics in general for my anxious dogs who also might have some GI, primary GI disease like food hypersensitivities, food allergies, inflammatory bowel disease, things like that. So that, again, I kind of can get 2 birds, 1 stone. I can help improve their GI health as well as their emotional well-being too. So probiotics are great. Pheromones are pretty cool. Pheromones are chemical signalers that are used as a form of communication between different species. They are species specific, so dogs only have the receptors for the dog pheromones, cats only have them for the cat pheromones. So you should not be able to smell any of the synthetic pheromone products that exist out there for dogs. But we do have synthetic, commercially available pheromones of the dog appeasing pheromone, which is emitted by a nursing mother when she has a litter of puppies. It's released from the mammary glands and it helps to facilitate calm and relaxed behaviors in the puppies. And another thing that clients like is that we don't see any reported risks or contraindications with the pheromone studies that exist so far. Although I do have one patient I saw recently who they tried one of the scientific-based pheromone products that is out there and said her dog went kind of nuts on it. So we just were like, okay, we're not going to go back to using that. But the pheromone products that do have data behind them are Thunderies. You might have been more familiar with it being called Adaptil, but it comes in a diffuser you plug into the wall, sprays. You can spray the crate, the car, the room, whatever, as well as a collar that the dog can wear. And then there's also Zenadog made by Verback. That picture is of the gel diffuser, so it doesn't require a plug-in. You can move it around where your dog spends the most space, and they have a collar as well. I'll briefly touch on this too, what we call behavior modification and how we try to change that emotional state of our patients so that they learn more desired, more, comfortable ways to cope with their stressors. Counter conditioning and desensitization is a common behavior modification strategy. And I just wanted to touch on what it was, so we had that information out there. Counter conditioning is the process whereby an animal is trained to perform a behavior or response that is incompatible with the problem response when the animal is presented with the problem evoking stimulus. And desensitization's definition is the gradual exposure and habituation to a stimulus that can lead to problem behavior, the result of which is to raise the threshold at which the animal responds inappropriately. So it's used to increase the animal's ability to control its response so that it elicits a desired versus undesired behavior. So whenever we're working on these skills, we want to ensure that a patient is below threshold so that we can continue to incrementally, move up to what they are comfortable with. However, with CCDC, with noise phobias, it doesn't seem to be the most successful for patients who have noise phobias. Patients, unfortunately, don't generalize very well. And for CCDS to work, the patient, again, can't be above threshold while we are working on behavior modification training. So it's not something, at least at our practice, that we use very often for noise phobias, but that doesn't mean it can't work for some patients who are out there. But instead, what we do is talk about alternative skills, different things that the dog can focus on to be calm and relaxed, whether that's simply redirection or teaching them look at that. So rather than focusing and engaging with the noise and, directing themselves to where the noise is coming from, they just want to look at you and look at that and play that game. Nose work can be really decompressing and fun, sniffing and using all those olfactory receptors that dogs have, so they have something else to focus on. Pattern games can be really good during these times. So again, if they have a pattern game that they know really well, they know what to expect. We're adding predictability, which is really helpful for dogs who struggle with anxiety and fear-based behaviors. And then you can even teach dogs to be relaxed, like that dachshund with the cucumbers on his eyes, and relaxation training so that they can be relaxed during these noise events is really helpful too. So these are just a couple of my references. If you want to go back and look at any of these papers or textbooks or anything like that. And then with that, any questions people might have.
All right, that was awesome. And I have loads of questions here for you. Wow. So back with the slide with the sound, which sounds are at what decibel level. Someone asked about humming insects, flies, or wasps. Do you see animals that are sensitive to that? I did look up and it says that wasps peak at about 170 hertz. So, and honeybees are around 240 hertz.
Okay. Well, with the decibels here, I believe that the scale is in like 140, meaning 140,000. So being in the hundreds is still on the softer side, right?
Mhm.
I haven't in clinical practice seen anyone say that specifically that I remember that their dog was scared of those noises. That doesn't mean it's not impossible, but they are pretty quiet. I think the other thing that might go into a noise phobia specific to like humming insects could be like the startle response too, where, if you've seen dogs fly biting before and trying to snap at flies that are bothering them while they're outside and things like that, they could be startled by the landing of the insect on or near them, and they usually are just jumping around on them, so they might find that irritating too. But it is not impossible because, again, noise phobias can really be to anything in the environment. So if that's something you appreciate, it's something that we would definitely want to address for that dog who is scared of those flying insects that are hard to control in the environment.
Oh, so the same person asked about the sound is, do you see them after they've been stung by something like that? Do you see them to be more sensitive to the sounds, or have you ever experienced that, or is there any data on that?
I have not seen that happen, but again, it's not impossible because if there is a negative, painful experience associated with the sight and or sound of the wasp that stung you, then you probably do have a fear response to then being able to see and or hear the wasp in the future when you come across them. So I don't think that's out of the realm of possibility at all. I think that's very possible.
Someone asked if you could put the resources page back up, so maybe we can put that up for a minute. Next question. Storms were the first thing that bothered I think it's Italian Greyhound. Then the sound of weed whackers, fireworks, even the emergency response sound on TV when a storm is announced. Putting him in the car or in a crate, though he's not a dog who is crated typically, seems to help. But he's now 13 years old, and she is wondering if there's an association with cognitive issues. She's also giving Dosequin, which seemed to help some, but that might be, she thinks that might speak to the fact that there might be some pain component as well.
There could be. I mean, dogs develop arthritis even before we might see signs of arthritis in them, like they're slowing down on walks or walking around more stiff or, things like that. So I think a pain component is something that could be looked at, and to bring it up with, the primary veterinarian. Cognitive dysfunction, we can see changes in your ability to perceive the world, diminished hearing, and sight, which can contribute to generalized anxiety. So oftentimes our patients who we suspect having cognitive impairment that is leading to anxiety, we're treating anything and everything concurrently to try to get the best results. So if there's a pain component, an anxiety component, we just want to treat it all, rather just so that we're having better welfare for that pet. So I think those are all things to be considered.
Let's see. I have a rescue terrier who is terrified at the sound of squeaky toys. So she passes them out when because her other dogs love them. So when the terrier isn't around, she passes out the squeaky toys. The same dog will not eat out of a metal bowl if his ID tag knocks against it. So she has to feed out of a plastic one. So that's a good kind of a recommendation of still allowing the other animals to enjoy those things when the fearful dog isn't around.
Yep. Or, even utilizing that environmental management technique of, I know that you don't like the clanging noise of your collar against the bowl, so I change my bowl, or I take the collar off, right? We try to manage that. So, because we don't want the dog to not drink or not eat, he or she needs to do that stuff. So,
Yes, exactly. Okay, so this was one that's very sensitive noise, but also to open spaces. Their backyard doesn't have very many trees, so the dog feels very exposed. When she's gone camping at the beach, would you say that this is more of a general anxiety combined with sound sensitivity? They say that she's allergic to civilization.
I mean, it sounds like it very well could be, because again, things like generalized anxiety, often we are seeing patients for multiple diagnoses, such as fear-based aggression or noise phobias, separation-related behavior, generalized anxiety. It's very uncommon for me to only have, I don't think I've ever had one or two things on my diagnoses list for my patients. And especially when things are unpredictable or just ever present, where just being outside is, like going into a minefield for a patient because of all the stimuli that are happening. That's where long-acting medications can come into play, because we don't have control of the world as much as we would like to for our dogs to make them feel better. But some dogs just don't want to go outside because of all the noise or that one adverse experience, where then sometimes it leads to house soiling because they're like, I'm safe inside. I don't want to go outside and pee or poop because it's scary out there. And so I think it's definitely something to be looked into for that dog.
Excellent. We've got a puppy now 4 months old, herding breed. She notices a lot of different noises, especially the garbage truck. So owner is throwing treats for her to eat and giving her distance, and it works at the time. But whenever there is some trucks or loud noises outside, she runs towards the owner. So she's giving her treats and giving her distance. What else can she do to help desensitize her to everyday sounds? And she says sound apps don't help.
Yeah, I'm not sure if I can give any specifics just because I'm not prescribing to your pet. I think it's always helpful to work with a trainer directly versus trying it on your own, just because at least with the trainers that we recommend, and this is what you should look out for too, trainers who use all scientific-based positive reinforcement, fear-free, force-free training methods, which is what your dog's friend does for us and our clients too, because we don't want this to progress any further. We want to try to nip it in the bud, but it could be something where we have all those environmental management strategies in place. We have our noise machines on to try to reduce that experience of the stimuli. We have, we're teaching pattern games and things like that so that we can utilize those when noise events happen to make, the excitement of the pattern game a neural pathway that we work on more versus the fear response that is happening. And I always tell people, as far as like looking for a trainer too, depending on where you're located, and maybe, it's not an area where trainers who are force-free are very popular. You wouldn't go to a doctor or a veterinarian who didn't have their DVM or their MD or anything like that, right? So don't go to a trainer who doesn't have their letters that, let you know that they've gone through rigorous training and to get their letters and their degree, and that they're following the science and know what they do too. But I think redirection, pattern games, focusing on other things like nose work, where again, dogs use their nose all the time. They love it. It's decompressing. Those are all things that can be helpful. And if it's really significant, talking to your primary veterinarian about psych medications and how they might help you and your dog too, to again, make sure this doesn't progress and continue to get worse and worse. That, if we can intervene sooner rather than later, then medications aren't necessarily forever. We get over the hump and then we get rid of them.
Okay, so Ruth is asking, back on the Sileo slide, you mentioned anxiolysis, and she's wondering what that is.
Oh, so just the word anxiolysis refers to just generally decreasing anxiety. It has an anxiolytic, bringing down that anxiety effect. So that's pretty much for any of the medications I was talking about.
Okay, so here's one. My 5-year-old German Shepherd has become sound sensitive. He's on fluoxetine, which does help. He's learned to go look when he barks at unknown sounds outside. Sounds like they've done a lot of work. But now she needs to play the piano when he goes berserk. When that comes on, she's trying to desensitize him. She can place her fingers on the keys without him barking, and he only lightly barks if she quietly plays a single key, as long as it's a low tone. She's wondering if she'll ever be able to desensitize him to the piano. Kind of related to that as well, and I'll add on to it, is do you ever see with noise sensitivity the desensitizing counter conditioning kind of plateau at a point, and the dog isn't able to go any further than like what she's describing here?
Yeah, I think with the piano dog specifically, like I would be concerned if that's like a sudden change, where again, I wonder if there could be a physical health component to it, such as pain, that is contributing, if it's something that's new. So that would be the first thing that comes to mind for me. What was the second part that you said?
Do you ever see it like plateau? We can get to like
Okay.
this point and then not get any farther.
I think you can. I think for a lot of my patients specifically, when, I'm working with our trainers or trainers outside of our clinic, but within our network, that it's not a skill that we work on much again. It's not something that we see happen often with counter conditioning and desensitization, just because it doesn't seem to be as effective. Dogs don't generalize it very well. But for like counter conditioning and desensitization in general, for things like, say, separation anxiety training and things like that, if a dog's kind of plateauing and getting stuck with our plan and we're not able to continue to make headway and progress, that usually tells me that my medication plan needs to change and we need to get it to be more effective so that we can continue to make more progress. Whether it is continuing to titrate up my longer acting medication like an SSRI, or layering in second or third short acting medication during those events and making sure that the dogs are not so sedate that they can't participate in training, which can happen. Dogs can be on 2-3 medications and tolerate them just fine. They're not zombies, and that's just what we work towards trying to find. But if things plateau, it's usually because we are stuck and we need to make changes to continue to make progress.
Let's see, multiple questions on supplements and drugs. Is clonidine ever used as a long-acting medication?
It can be. I feel like with our medication plans, where again, every dog's an individual and responds differently to each medication, I'm always trying to use the lowest effective dose that doesn't cause any side effects. They tolerate it well. It's doing what we want it to do and reducing their anxiety and fear responses. But I also, again, I don't want to have side effects. So sometimes we do have to use a combination, and sometimes that is a long acting and a short acting medication. And so clonidine, as long as it's well tolerated, can be safely used around the clock lifelong. It totally can. And it's keeping in mind that these medications work on different neurotransmitters biochemically in our brains in different ways, even if they work on the same neurotransmitter. And so we're trying to get that synergistic effect. If clonidine works on norepinephrine and my Reconcile, that doggy Prozac, is working on serotonin, those are 2 different neurotransmitters that they're kind of focusing on. Not that they can't have downstream effects on other neurotransmitters, but that's kind of general terms. They're focusing on 2 different ones. And so if I can get a synergistic effect that is good and my patient's doing well with it, then yeah, we can definitely continue it.
I've got somebody who asked about where you practice. So do you have a contact slide at the end there that
Oh, yep.
can pop up?
With the
There
question
we go.
slide, Animal
Perfect.
Behavior Wellness Center. So we have two different locations. We have our Fairfax, Virginia office, where Dr. Pike and two of my resident mates, Dr. Eng and Dr. Engler, that's not confusing, are. And then I also, a couple times a month, I'm in our Richmond, Virginia location too. So it's me who's there a little bit, as well as Dr. Amy Learn, who is another board certified veterinary behaviorist.
Okay, so we have a dog behavior consultant who has worked with or is working with anxiety, phobia, and aggression cases. She has several dogs on long-term gabapentin showing heightened aggression and sudden onset noise phobias. Is this something that's been studied, or is there any source out there about the frequency that this occurs?
That's really interesting. I will say that paradoxical reactions, where again, that opposite of the desired effect that a medication is having, can happen with any psych medication. So it's always something to watch out for. And if it's something that's being appreciated and the gabapentin's just started, then I would be worried, a paradoxical reaction is possible. I think the other thing is if these dogs have been on gabapentin for a while and there's a new change, if side effects happen, you're going to usually see them pretty quickly. The owners are going to appreciate it, especially for the short-acting medications, but the long-acting meds too. It's usually within a few days, not months or years later, that you're going to see side effects happen. And so if it's not within, days of being on this medication, I'd again be worried it's either there's progressing of the underlying anxiety, fear-based disorder that is happening, that over time it does progress without intervention. That two, there might be something medical going on as well, whether it's, skin irritation with allergies, pain with arthritis, GI discomfort with inflammatory bowel disease or something like that, that there might be something else going on that is leading to that too. But as far as like studies out there, the most common reported side effects in the gabapentin studies that I've read so far have again been sedation and ataxia, that uncoordinated, stumbly sort of gait. So gabapentin overall is very safe and well tolerated, but again, it's not for every patient either.
So a couple more questions about your clinic. Do patients have to be referred to you from their primary vet, or can someone just contact directly for an appointment?
Yep, they can contact directly. Referral is not required, so we're happy to see you.
And then someone else asked, she said you may not be able to answer it, but do you know if, I suppose it depends on the company, but do you know if any pet insurances cover behavior consulting or behavior vets?
Yeah, I mean, it does vary, and I don't work for the pet insurance companies, so I don't know who covers what or what plan within a company covers what. But we do work with clients who have pet insurance, and we try to help them as much as possible to get it covered if it's something that their plan allows. So, office visits, if they can be covered, and that, medications, and even, we write our discharge instructions in such a way that it's like your veterinarian prescribed such and such behavior modification training, so that hopefully is something that could potentially be covered by pet insurance too, even the training part of things.
Excellent. So yeah, that's something that I would probably say call your pet insurance and
Yeah.
ask them what they cover. So let's see, have you ever used Tellington Touch with anxiety clients?
I have not personally. I have heard about it and read about it briefly. I don't know a whole lot about how it works. But again, if it's a modality that we're using in conjunction with everything else that actually is helping a patient, then I wouldn't discontinue it. But if it's not doing anything, then yeah, you don't have to continue it. But I personally, unfortunately, don't know a whole lot about it.
Okay, so with regards to supplements, I know you mentioned that Adaptil and Doggy Zen both have some evidence behind them that they work. Is there any other data on supplements? And somebody else asked about calming chews in particular, which ingredients have been shown to actually be effective?
Yeah, so as far as the pheromones go, These are the only two products that I know have scientific studies and data behind them. I think there are not a lot of, because they're not regulated supplements and adjunctive products, anyone can make them. And so they don't actually have to say what they say they have. So these are the two companies that I trust as far as like the dog pheromone products go. But there are other ones out there that, again, if a client tells me that they are already using a pheromone and I ask them which one and it's not one of these, then I switch them to one of these. The supplements, where again, we have that like probiotic strain. We have the milk protein supplement. We have the green tea L-theanine supplement. Those are the ones I know the most about. And because they are veterinary products, they have sort of like a quality assurance to them too. I think with a lot of the over-the-counter supplements that might be out there and claim to have anxiety reducing, stress relief sort of responses, where again, anecdotally, they may help. And if they do, there's probably no harm in continuing them, but they don't have the same sort of backing as these supplements that I talk about do in terms of having the ingredients they say that they have, having like even distribution, like these Angstine tablets, you can split them and one half of one tablet is going to have the exact same distribution of ingredients as the other half. Whereas an over-the-counter supplement, you break that two in half, could be very different compositions. It might not be evenly distributed. And again, just making sure the ingredients are actually what they say they are. You want that quality assurance. So I don't necessarily change things if people think that something over the counter they're using that is not among the things I've talked about is helping, unless I think there's a harmful ingredient in there. But these are the formulations that are specific to dogs that I trust because of the quality control, the scientific studies and data behind them telling me that they actually do have a benefit.
Since you mentioned calming chews and so many of those are CBD chews, is there any evidence of CBD actually helping?
That's an easy question because the simple answer is just no. There is not. I feel like there is a lot of interest in CBD. I think it's something that people are studying quite a lot right now. But I think as far as, following the science goes, I don't have any good studies to, again, back the use of any specific products to be like, this is what I'd recommend. It actually says it has the product that's in it, it's evenly distributed and things like that. I think because it's such a hot button topic, that there is a lot of money and research going into it. So I might have more to say about that in, a few years from now. But right now,
Yeah.
unfortunately, the answer is that simple. Nope, sorry.
All right, so since we're in supplements, let's stick to those. Are the probiotic supplements that you mentioned over the counter or prescription?
So all the supplements are prescription or non-prescription, I should say. So the Calming Care, Visbiome, ProViable is another good one, or Purina Mix Fortiflora. I think for Purina, the Fortiflora SA is only available through prescription from your veterinarian. I might be wrong. I've been out of general practice now, so I don't know for sure. But for things like Calming Care and Visbiome, yeah, you can get those on your own.
Let's see, as far as pheromones go, do you ever see dogs who are acting negatively to cat pheromones that a person's using in the home or vice versa? Or are they close enough in composition that they can use both and there's no big deal?
Yep. So we actually do often, if clients have, both dogs and cats, or if, it's working on their relationship and they're not getting along very well, or even at the vet clinic, some vet offices will have both the dog and the cat relaxing pheromone in their office. The receptors are, again, they're species specific. So dogs will only be able to detect the dog's pheromones and cats will only be able to detect the cat ones. They should not react because they don't have that equipment in their body to be able to perceive the other species pheromones. The electric outlet diffusers, sometimes they have like an alcohol-based smell to them. That might be something both people and other animals can smell, but the pheromone itself is, again, species specific. So I haven't heard that be reported by any of my clients who might be using both in their house, that they're like, oh, the cat thinks this is weird, or every time he walks by it acts funny, or the dog one, or something like that.
Yeah, okay. Let's see, why do vets prescribe Reconcile versus fluoxetine? Isn't fluoxetine cheaper?
Yeah, no, that's a good question, because I think that's something we get a lot too. And I think primary care veterinarians, just because fluoxetine does have, the most study and data behind it for both human psychiatry and veterinary psychiatry, that it is very commonly prescribed by primary veterinarians before a patient comes to see us. They might already be on it by their primary vet. Generics do tend to be cheaper too, versus, the dog specific flavored Reconcile. But there is that difference in bioavailability. Because it is specific to a dog's metabolism, it is, I believe it's about 20% more bioavailable to dogs, meaning their body is getting more drug out of it versus, no effect with that 20% on the fluoxetine. And because it's more bioavailable, we see a more robust response if dogs respond well to fluoxetine. And that's kind of what we want to have happen. Sometimes me, Dr. Pike, Dr. Learn, my resident mates, when we make that switch and have a patient who's tolerating fluoxetine well, who is responding to it somewhat, but not as much as we'd like, and we make that switch to Reconcile, that's all we had to do. And so I would much rather use Reconcile, unless there's, of course, a cost concern and generic is helping the patient and things like that, but I never prescribe fluoxetine just because Reconcile is a dog-specific medication that is more about 20%, I believe, bioavailable to them.
Excellent. Let's see, can most vets do gut biome testing?
I don't know how much of that is being done right now. I know there's, studies that look at like the fecal microbacterial, balance and what that looks like. I know like with basic blood work, if you're looking at protein values to make sure that's not like what's called a protein losing enteropathy, which could be loss of nutrients in the GI tract and contributing to that. There are specific GI panels that are done to test things like absorption ability of nutrients, digestibility, how well you're able to do that by looking at some GI markers in the blood. But as far as looking at the specific microbacterial, like the gut flora and what that balance looks like and what it should look like normally, I'm not aware of that being tested like routinely.
Let's see, okay, so kind of a question about desensitization, counter conditioning. Someone mentioned that they've found that doing more active soothing distraction as part of the behavior modification seems to work better, and doing activities, tricks, and rewards as compared to using food rewards seem to work better. Do you know anything about that from the trainers you work with?
I think it depends on the dog. What the primary or secondary reinforcers for the dog is and what they respond to. It's different, every dog responds to things differently. So food just tends to be a really good primary reinforcer because everyone needs to eat, right? And we don't have many primary reinforcers. But if there are other things that work and work well for a specific patient, whether it's attention, whether it's doing well with training, and that's a good distraction because it's fun, whether it's playing with toys, things like that, it just depends on what is reinforcing to that learner and what's effective.
This one's mine. So head shaking in dogs usually look for ear stuff, but I worked with several mature to kind of early senior dogs, and actually my Australian Shepherd is one who's just started doing it, shaking their head after barking. No other time, but just giving a head shake after barking. Is that like do they be more sensitive to their own voice as they get older, or?
I would probably, everything depends on context, right? But if a dog is barking at something, whatever it might be, I see kind of that like head shaking or body shaking is kind of a reset, and that like, oh, that stressed me out, but now it's over and I feel better, and I kind of do that shake off. We
Mhm.
see dogs do the shake off a lot when they first come into our exam rooms and then kind of settle. They do that shake off and then they're, exploring and things like that. So I wouldn't think of it more as them being startled by themselves, so much so as like there's something that is concerning them that they're barking at, and then they need to kind of shake it off and reset.
Right. Yeah, it's interesting because the ones that I've seen, it's just a head shake. There's no full body shake. It's just the head. So it's kind of interesting.
Hmm. Yeah,
Um,
interesting.
Let's see, that looks like that's the last question. So thank you so very much, Dr. Nalla, this was a fabulous presentation.
Good. I'm glad. I hope everybody enjoyed it.
Thank you, everybody, for joining us. Again, if you'd like to donate to Your Dog's Friend, you can go to yourdogsfriend.org and click on the donate button. Thank you, everyone.